I'm waiting your questions. The question from Awat, which type of Cpap, continuous or variable flow, you are using in your unit and why? I told you about. We use the variable flow Cpap. But when we transport baby from resource room to the NICU, we use continuous flow Cpap. When we have transport, we use continuous flow Cpap. When we have a nasal problem, we use continuous flow Cpap. When we have, for example, cleft lip and cleft palate, we use a continuous flow Cpap. When we cannot fit, we use continuous flow Cpap. When we don't have machine, variable flow machine and generator, we use continuous flow Cpap. But variable flow Cpap is superior to continuous flow Cpap because it decreases the work of breathing. Because in continuous flow Cpap, you should not use the generator. Usually you can use nasal prong and it fits very well and easy, and you can transport. Also, you can use transport ventilator. And I was also asked about ventilator having a compressor or Cpap having a compressor. Oh, Cpap and PEEP. Cpap is a pressure above atmospheric pressure. So if you put in the nose any pressure above atmospheric pressure, that is Cpap. PEEP is the pressure required to keep alveoli open. And PEEP are of two types, the provided and the measured. I'm going to answer the question, Majid, in 1 minute. I'm just answering this question. I'm going to answer your question. So Cpap is the pressure above atmospheric pressure. For the purpose of ventilation, atmospheric pressure is 0. So anything above this is Cpap. Whether this will provide PEEP or not, that's a different issue. PEEP is the pressure inside the alveoli that keep alveoli open, keep it from avoiding sticking. When you do bilevel Cpap, you have to provide inhalation and exhalation pressure. The inhalation pressure, or IPAP, and the exhalation pressure, or EPAP, the EPAP is supposed to be equal to the PEEP. But again, both of them are continuous flow. They are not Cpap. So the difference between PEEP and Cpap is way big. The other, in case of PVD, how long using Cpap? You can use it for whatever the patient needs. You can send the patient on Cpap. You can use it for 3 months. You can use it as much as you need. You can use it as much as we need. Sometimes we use it for 4 months. Cpap mode in ventilator can be used by ETT only, or can also, yeah, we talked about Cpap from ventilator is a continuous flow Cpap. So you can, regardless the interface. But continuous flow, you cannot use it with a generator. So if there is no generator, you can use it with mask, the Cpap derived from ventilator. You can use it with mask, nasal prong, ETT, or nasopharyngeal. Do you mean IPAP? I don't know, what does that mean? In Cpap, you cannot control PEEP. Cpap is different from PEEP. In Cpap, you cannot control PEEP. There is no PEEP in Cpap. Whoever told you that there is PEEP, there is no PEEP. There is EPAP, or the pressure during expiration. PEEP is inside alveoli. It's only in ventilator you can provide PEEP. And in ventilator, two PEEP. The PEEP that you provide and the effective PEEP inside. They call it IPEEP. CPAP is not PEEP. You cannot provide PEEP. It's not PEEP. You cannot control PEEP. But when you use bilevel CPAP, continuous bilevel CPAP, you provide IPAP and EPAP. There is no PEEP. Now, how much the patient is getting, that's the effective PEEP or IPEEP. CPAP is different from PEEP. You cannot control it. But when you use two-level CPAP, you can control the EPAP, or the pressure during breathing, exhalation, IPAP, the pressure during inhalation, and because you have IPAP, you will have rate. How many times you give per minute? So you have to set up the rate. And because you have IPAP and EPAP, you have to set the time of each. How long the EPAP and how long the IPAP. So you set many things. And of course, you have to set the oxygen. No. There are 15 here. People are asking me about it. There is 15 in continuous, whether it's a variable flow or continuous. There is 15 in CPAP. And there is 15 in bilevel CPAP. In bilevel CPAP, you cannot, EPAP, you cannot reach 15. The IPAP can be 15 to 22, while the EPAP, it can be from 6 to 7, or 5 to 7, or 8 sometimes. But in a plain CPAP, not bilevel, whether it's a continuous or variable flow CPAP, you can reach up to 15. CPAP can be used in lung hyperinflation or better mechanical ventilation. Well, it depends. Is your patient breathing? Is your patient dynamically stable? Is how much oxygen you are providing? What is your blood gas? So CPAP can use for, it depends on the indication, whether it's a mechanical ventilation or a CPAP. In case of tracheostomy, oxygen dependent patient, how can I use alternate ventilation and CPAP? When you use tracheostomy, it depends on the interface that you are using. So you can use CPAP, but you make sure that the interface gives the patient room to exhalate. You can use nasal prong. So it depends on the interface with the tracheostomy, which one you're using. So you should have interface connected to tracheostomy, because I didn't talk about that. That's a different subject. We're talking about ventilation, not tracheostomy. So you can use just flow to provide oxygenation if your CO2 is okay with tracheostomy. If your CO2 is not okay, you can use CPAP. You can use TPs. And CPAP, the interface can be prong, can be mask connected to this. So it depends. Mask and you connect. Same. You can use continuous, you can use variable flow. If variable flow, you should use the generator. So the other question, okay. The question is, what is the difference between CPAP and PIPAP? Well, you've written PIPAP, it's BiPAP, not PIPAP. It's BiPAP or bilevel CPAP. PIPAP have two pressure. One pressure during expiration called EPAP, and one pressure during inspiration called IPAP. And because you have two pressures, you need to set the rate of each of them and the time of each of them. While CPAP is one pressure, continuous, during expiration, and that's only the difference. And because you have two and backup rate, when in bilevel CPAP or BiPAP, you get better ventilation because you have more washing. Minimum PEEP in a newborn in ventilator. I think 5 would be reasonable minimal PEEP in a ventilator. A minimal, well, that's another topic. We're not talking about ventilation. Max PEEP, 14, 15. Max PEEP in ventilator up to 14. In case of burning, I think the spelling is wrong, but I think you're talking about burning. If there is burning, if there is burn around the nose and it's severe, it can cause infection, it can cause more pressure, it's better to intubate and ventilate. Yes, you can use minimal non-invasive ventilation without sedation. If the patient tolerates it. If the patient does not tolerate, you have to use one of the three options that I've told you. Any more questions? You're most welcome. Any more questions? I hope I answered all the questions. No more question? Then I'm going to close this. Thanks for the attending. And when the software record, I will post it on Facebook, on YouTube. How you can calculate Cpap in machine? You just set it. If you don't have the pressure, you look at the flow. So usually the Cpap level is the pressure plus 3, you get the flow. So if you have a flow of 9, usually your pressure is 6. If your flow is 10 liter per minute, usually your pressure is 7. But that's a gross. But it's better the machine to measure it, because you can use nasal flow with the flow, not Cpap, to give you Cpap. And if you give 10, then it's giving you 7 pressure, almost. But that's not measured. It's not regulated, so you cannot use it. So the machine should calculate how much pressure you get. Does patient age influence? No, the patient age does not influence. It's the case of the patient, what exactly you want to do. If you are not transporting and you have the machine, use variable flow. When you have a burn around the nose, do not use Cpap. You should intubate. If you need, you can use nasal prong to provide flow, but not Cpap, because Cpap will give you pressure and you can easily damage the nose. So intubate through the mouth. Do not use the Cpap. Which machine? No, if the Cpap has compressor itself, it should not be used. Machine with a compressor should not be used. This is only for adult. This is not meant for children. It's too dangerous. Do not use a machine, Cpap machine, in pediatrics. Cpap should have pressure from medical air central and oxygen, and use a blender. Never ever use a Cpap getting its own pressure from a compressor inside the machine. That's incorrect. Never do that. And that's why these machines are cheap. These can deliver different type of pressure. It can stop at any time. It's difficult to regulate, and it should not be used. Only Cpap used for pediatric is through a pressure from a central source, a medical air, and oxygen, and then a blender. Either the machine blend it, or you should have air oxygen blender. Never ever use in pediatric. A Cpap has its own compressor. These are only meant for adult, because it can give you a flow up to 60 liters and down to 8. So never ever use Cipa with its own compressor. These are, even if the company said so, these are not for pediatric, and that's why they are cheap. So never ever use Cipa with its own compressor. These machines are waste of time and money. They should not be used in pediatric, because the pressure provided is inconstant. Can go up and down. It can stop. You cannot maintain it. Have shorter lifestyle. Nagla, I do not remove names from ultrasound course. I have a room to a number of people who already registered. There is no emotion in this. So either if somebody withdraw and I will remove some name and you have room, I will post. I will take the first names that comes to me. The first one I will register it. The second until I full, and then I stop. There is no emotion or a prejudice in this. It's just a matter of the way I do work. You are most welcome. And then I'm going to end the talk and I will post it on Facebook. Negla, we can talk privately on that later on. Thank you very much. Have a nice day. I'm gonna end the talk.